Hello, everyone. Welcome. Thank you for joining Inspira's virtual town hall for school administrators and nurses. My name is Tom Baldessaro, and I'm the Chief Financial Officer for Inspira Health. The first thing I want to share is you can see, I'm wearing a mask. We have about 15 people in this room. We're all more than 6 feet apart, and we're all wearing our masks. This is one of the safety protocols we have in place. Even though we're social distanced, we still wear our masks. I want to thank you again for joining. In the purpose of collaboration, I want to share that over the past 5 months, Inspira has been working tirelessly to plan and prepare for the safety of our employees and our patients. And we want to share some of that knowledge and be a willing resource for all school districts in our area. Joining me today, I have Dr. Evelyn Ballaghan, Medical Director for Employee Health, Occupational Health, and Urgent Care. We also have Dave Johnson, our Vice President of Innovation. Next is Joe Durella, Executive Director of Retail Development. We have Joe Kaufman, Director, Occupational Health Services. And also Megan Anastasia, Infection Control Preventionist. Throughout this presentation, you will have the ability to ask questions. Please just type them into the screen, and after our short presentation, we will get to as many questions as we can. Without further ado, I'd like to kick it off to Joe Durella.
Yeah, thank you, Tom. What you have here in front of you right now is just some current statistics that are going on, not just globally, but through the United States, and we've actually broken it down county by county. If you take a close look, you can see that these statistics are actually from the 16th of July. Gloucester County has had a slight uptick in their positive cases, where Cumberland and Salem have either been stable or actually are moving in a direction downward. We wanted to make sure that everyone recognized what was happening here across our region specifically. We also want to make sure that you understand transmission rate. Right now, as of July 15th, the current transmission rate here in New Jersey is 0.93. So what that means is for every one new positive case, the transmission is less than 1. At the height of this pandemic here in New Jersey, that number was as high as 6. So again, the state of New Jersey, all the residents have done a tremendous job trying to make sure we control the spread of this virus.
So, where are the challenges, right? We all know there's challenges, and that's why we're here. And these are some things that have come up in calls that we've had with school districts over the past few weeks. And I'd just like to read them off. We've heard people are concerned about having enough PPE, having enough, obviously, supplies and hand sanitizers. There's a concern about staffing, both teaching staffing and nursing. Proper disinfecting procedures, what the screening of the student and worker population is going to be. If there's a need to test student and workers, how that would be done, how you will perform contact tracing, and also the logistics of the transportation. So how can we help? Well, we feel that we're uniquely qualified to be able to help with consortium purchasing of PPE and supplies where that's possible. We have telehealth that we've rolled out, and we do these exams both for the need to evaluate employees and students, and there's also going to be behavioral health telehealth coming. We can also provide assistance with return to work for employees, and also we can help in the return to school process for students. Lastly, we feel that we're able to facilitate conversations between key stakeholders in helping keep everyone safe. With that, I'd like to turn it over to Dave Johnson, our VP of Innovation, to speak about one other way we can help.
Hello, everyone. At Inspira, our normal operating procedure is to activate our Emergency Operating Center, or EOC for short, during any crisis. In March to current, our EOC has been active in our COVID-19 response. The team is a multidisciplinary team, including professionals in quality, infection control, operations experts, human resources and employee health, and clinical staff such as nursing. The primary purpose is to maintain situational awareness, help communicate to our leadership for critical decision-making, understanding state, federal, and local guidance, basically operating as a constant monitor for escalation and de-escalation efforts, in this case for COVID-19. We'd like to offer that as a resource to you today. You could reach out to covid19@ihn.org. With that, I'd like to turn it over to Dr. Evelyn Balogun.
Thank you, Dave. This topic is very important to me. As a mother, I'm interested in having my own kids safely return to school. As a clinician, my goal today is to provide and share guidance information that can hopefully provide more clarity as we continue to acclimate to our new norms and reopen our schools. So how can schools safely reopen? This question is top of the mind for educators and parents. We should recognize that there are several stakeholders in this process. Teachers, students, parents, and administrators must all have a voice in the conversation. Managing the risks of person-to-person spread is key to mitigating the impact of COVID. This can be accomplished by a multi-step approach, which includes symptom screening, temperature checks, use of masks and face coverings, hand washing, and social distancing. Let's first address the issue of screening. As we have seen in some workplaces, it is important that schools develop processes for ongoing surveillance, as this helps to ensure that students and staff can safely report to school on a daily basis. With the issue of screening, it can be performed at home and prior to arrival at school using safe self-assessment tools which review the most common symptoms of COVID-19. The primary message of these processes is to reinforce that students and staff should not come to school if ill. Let's look at what's worked worldwide. We have examples of safe school reopenings in countries such as Japan, Norway, and Denmark. These countries have safely reopened using specific measures centered around the following: physical distancing, staggering openings with earlier return for younger children, smaller class size, dedicated effort for infection control practices, and use of face masks. We can learn from countries such as Australia and Israel, who experienced COVID outbreaks after their schools reopened. The difference here is that both countries focused on sanitizing their environment but did not require use of masks and perhaps placed less emphasis on social distancing. Next slide. What does this mean for New Jersey? These global experiences create a roadmap and guide for our own efforts. In New Jersey to date, we know that persons aged 20 and under represent approximately 15.6% of COVID cases. Though children are at much lower risk of getting seriously ill, the risk is not zero. This still correlates to an estimated 27,000 of COVID cases statewide. So it is very important that we understand the risk and respond appropriately. Next slide. To review, our roadmap to reopening must focus on key success factors. This includes measures such as physical distancing, screening of staff and students, use of masks and face shields, and testing when feasible. Testing can conclude a combination of a baseline test prior to the start of the school year, as well as a rolling process for testing throughout the school year for any persons who are symptomatic. Finally, our roadmap must specifically focus on a vigorous and active process of education and communication that includes output to all stakeholders. With that, I'll turn the presentation back to Joe Kaufman.
Thank you, Dr. Balogun. As Dr. Balogun said, first and foremost, I'm a parent, and second, I'm a health and safety professional. So I want to be clear that what I'm about to tell you is really for the purpose of informing you. It's not meant to alarm you. It's really being done for the purpose of giving you advice and helping you make decisions that will keep our students, our medical personnel, and our employees safe. The first thing I wanted to talk about is the safety hierarchy controls, and this is a process by which they assert that you can substitute and eliminate and use administrative controls and engineering controls to try to lower your risk. The last part of this is personal protective equipment. So what I would like to say is, I've heard it argued that elimination is not possible since COVID-19 is a virus, and that we can't control it. And in a certain sense, I would agree with that. However, We do control the activities, interactions, and the social distancing. We've seen across the board that there's a need to be flexible here. We obviously don't want people showing up to school or work sick. It's better to not have a sick person come to work than to push somebody who is sick to show up. If you're truly concerned with a case being abused, you're able to utilize a fitness for duty exam for your workers, or you're able to utilize our urgent care and telehealth networks for a student. Also, as previously mentioned, disinfecting is very important. And on the EPA.gov website, there's a list called List N. And List N specifies the types of chemicals and the contact time needed so that it would kill the virus. So, again, to reiterate what Dr. Balogun said, it's critically important for us, regardless of the size of your population, to build an assessment and screening plan. This assessment can be as simple as a questionnaire and as advanced as the kiosks that we see on the screen. One thing that I'd like to emphasize is that it's critically important to understand your site access points and understand how to assure that someone cannot circumvent the process of screening by entering the building in another location. I would highly recommend that you have controlled access for entering and exiting your building, and I'd suggest in non-emergency situations you separate those. You want to limit your entry and exit doors also during non-emergency situations, and consider dismissing your classes in a staggered fashion that may allow groups to maneuver in the hallways to their next classes as opposed to the large group. We have to remember ultimately that a failure of our process is having a sick employee or student come to work or school and get through all of the screening processes before they identify that they're not feeling well or they've been exposed to someone who is a suspected case. Before we leave this slide, I would like to show you what Inspira has been using to test for temperatures, and if it were to read high, it would refer you for additional testing. You have to click next slide. So with that,
Didn't work.
one of the many unknowns in COVID-19 is that we know that it's spread via droplets which are exhaled, coughed out, or sneezed out. And one thing I can say with certainty is that if you're inhibiting the ability for droplets to exit, you're doing your part in helping others, and you're also protecting yourself. But not all masks are designed alike, and not all masks will help protect you the same way. So while we know that an N95 respirator, for example, is supposed to be 95% efficient in filtration, it's also dependent on many factors like fit, seal, facial hair, and other things. And so, in many cases, that 95%, it's far less efficient of that because of those factors. Keep in mind that unlike other face masks, an N95 is considered a respirator, and even if it's used on a voluntary basis within your workplace, it has such rules requiring a medical clearance and a fit test to ensure a proper seal. At Inspira, we're using surgical masks with a great deal of success. And something to consider is, during a higher risk situation of droplets coming out, you would combine a surgical mask with a face shield. So, we all know that the inevitable pushback on masks is coming, and there's the feeling to some that the masks do not help. I wanted to use the next few slides to kind of demonstrate the point that they will help assure the safety of our students and employees. There was a study published by a journal called The Physics of Fluids, and it was called Visualizing the Effectiveness of Face Masks. It gives a really good visual to what the masks are doing, and while I've only selected a few to demonstrate the point, the article is very good. So what do we see? Well, obviously all masks have their limitations, and in this first slide, this is a bandana. And going to our next slide, this is more of the homemade sewn type mask. And finally, this is the type of mask that you would purchase in a store. These types of masks all indicate one thing. The uncontrolled group can travel an average of 8 feet. And as you can see, even the bandana would cut that in half, and the other masks considerably more. What we see, however, is that the study shows even the worst mask provides a protection factor not seen in the unmasked control group. These next points are designed to get you to really think and have a conversation with other critical stakeholders in your building. And who may that be? In terms of engineering controls, it may be your plant services person. Do you have the ability to change the amount of air that's being brought into your building for more air exchanges? Do you know where your return air ducts are coming from? For example, if there's one outside of a classroom. And if the case of someone being positive in that area, would you be able to shut that particular return air unit down? In terms of exposure criteria, part of the safety process is lowering your risk. So, certain medical processes should not be performed in your nurse's office. that would generate aerosol, for example, a nebulizer. This would lower your risk from a medical exposure, which would be considered high, to a middle exposure, which would be considered medium. A few other operational considerations that we had with regards to the safety process, and again, these are designed to spark thought and discussion within your own organization. You may even have additional things that you speak to once you review these, and I think that's a great thing. First, we know that the preparedness is the key for any emergency. And while we're primarily dealing with COVID-19, we also need to be prepared for other situations. And for the drills in those situations, we need to remember that we should be socially distant. As we outlined a few slides ago, List N from the EPA is a good source of chemicals which have the ability to kill COVID-19. It's important for you to decide, how are you going to clean your classrooms and at what frequency? And how are you going to clean your buses? And will that be done between bus runs? Finally, if you have a student who may be immunocompromised or potentially an objector to a mask, which may place others at a higher risk, do you have a plan to handle this? And one thing that we think is that this whole process is not going to be successful without the effort of all of our teams. And it is important that you consider appointing champions who are going to make sure that they promote and remind people of the process all the time and help assure compliance. I thank you, and please stay safe. And at this time, I'll turn it back over to Tom.
Thank you, Joe. We do have a few questions, and I will read through them here. Megan, our district is working on our reopening plan. Is there any new guidance or suggestions on when to keep kids home or send kids home from school? We are assuming that the criteria may be more strict this year in light of COVID.
So, thank you, Tom. So the symptoms of COVID, as we all know, fever, chills, shortness of breath, fatigue, body aches, sensory loss, diarrhea, congestion, runny nose, these are all, any one of these symptoms would be a reason to keep a child home or send them home if they're exhibiting any of these signs or symptoms, because you just do not know. I would say it's definitely more strict. Anyone with a fever, 100.4 or above, should be sent home or kept home. So as far as guidance goes, the school districts are really going to have to come out with a policy that kind of go through the CDC's website and see what are the symptoms, maybe add that to your policy of when to send a child home, when to keep them home. And I think it's important that those symptoms are made available to all parents so that they are aware, if they may not be aware, that they should be keeping those children home with any of those symptoms.
Thank you, Megan, and stay ready because I'm going to give you the next question as well. Has to do with N95 masks.
Okay.
Do you think schools need them? And if so, would Inspira be able to help with fit testing where appropriate?
So I can ask about whether you would need, I can answer whether you would need them. So as we've already discussed, that this is a droplet transmitted virus. So surgical masks are really going to be protected, they are going to protect you from any droplets, sneezing, coughing, as well as social distancing. An N95 mask would really only need to be used, and this is per CDC guidance, during an aerosol generating procedure, such as administering a nebulizing treatment. If you do not have access to an N95, I don't see how it would be possible to do a nebulizing treatment. So with that, I would say if you are a teacher or if you are just taking care of a patient, or student, excuse me, a surgical mask should be sufficient unless you are doing an aerosol generating procedure.
And then I can say we have offered to help with fit testing where needed. If some school districts have told us they're not going to do those treatments that Megan just identified, but if you think you are and you need that, we can certainly have further discussion. Next question, Joe Dorella. Relation to quarantining, do you have any suggestions that they could share with families in the event that they do need to quarantine?
Thank you, Tom. That question is extremely challenging in regards to every house is different. Having a relative, a nephew who did experience and had to be quarantined up in Massachusetts and conveying back and forth to my brother-in-law, there were a lot of different things that he came up with, and also some of the things that we've been able to discover as a team going to various websites. Obviously, you want to limit that individual to one room, and one room only if possible. And that right there in itself will help control. The other thing is try to create circulation in that room, have the windows open if it's appropriate, things of that nature. When serving food and things of that nature, don't allow them to prepare the food. Make sure that the appliances that they utilize when they eat would be of paper or plastic so that they can immediately put them into the trash, which would be in that one room where they're staying, and be able to control that. Obviously, they need to use a bathroom, so having one bathroom in a house or two is going to make it a little bit different, but always have wipes available for the person who is infected. Make sure that they're available when they go into the bathroom. Make sure you remind them to grab one of those wipes, and as they exit the room, make sure they touch and clean all the touch points that they may have come in contact with through the bathroom. Also, circulate the air in that bathroom. Close the door, have the exhaust fan on if they can remember to open a window, and try not to enter that room for as long as possible. Maybe give it a half an hour or more before someone else enters into that room. Also, we learned, make sure that you just have one caretaker. Try to make sure that you limit the contact with the individual that's quarantined in your house. That should be the person who is the most healthy. You don't want to have someone who may be of an older age or someone who has comorbidities that could be more susceptible to that. As far as laundry and cleaning, there should be a plastic bag of some sort in the room where they're quarantined. They should put their clothes in there. The person that takes that should make sure they do protections, take the bag immediately into the washer, clean it with proper cleaning solutions, make sure it's very hot water. And again, everybody else in the household, masks, hand washing, hand sanitizing, and social distancing from the individual that's being quarantined. It will be a challenge. It was a challenge for that family and my nephew and his family to make sure that they maintain that kind of social distancing. It's very difficult because, again, as parents, we want to run and we want to try to help. The same if you have someone, a loved one. But again, to protect yourself and protect them, you want to take some of these precautions. And you can find more on various websites as you go onto the internet. Thank you.
Thank you, Joe. All right, next question, Joe Kaufman. Can you explain how Inspira can help with testing for either employees or students?
Sure, and I think this would be dependent on the particular situation, but by example, if you had a student who was ill in a classroom and maybe we had 10 students, the goal would then be to set those folks up with a telehealth exam. We would then have our physician evaluate them over the phone and through our telehealth platform, which is video. At that point, we would then determine the need to test. And if the need to test is there, we do have testing sites across the region that we can refer you to, and the order would be given. So essentially, it would be a touchless testing process. You would see the doctor through telehealth, and you would be tested at that point, and we would wait for the results to come back prior to releasing you to return.
Thank you, Joe. A couple questions about the presentation itself. Will the recording be available? And somebody asking for us to repeat the website for the chemicals or the disinfectants available. We will be sending the recording out and the presentation, so you will be able to access all of that.
And that website is the EPA.gov website. If you Google EPA.gov list N, as in Nancy, you will find it.
Megan, I'm going to put this next question to you, and it has to do with the nebulizer, further clarification on what you talked about. Can you clarify when a nebulizer should not be administered to students in the nurse's office? Again, we've talked to multiple districts, and some have said they're going to do it, others not. Some say it's not possible, but can you just add a little bit of clarification on that?
Sure. So the CDC guidance is if you're going to do any kind of nebulizer treatment, it would have to be outside, or you would have to have proper ventilation, and a lot of schools do not have that kind of ventilation. And again, access to N95s while administering this nebulizing treatment is difficult. So if at all possible, if they can have an inhaler that they can administer themselves that is an enclosed system, that is what is preferable. Or have the student administer the nebulizing treatment at home, or have a parent come pick them up, administer the nebulizing treatment at home, and return them back to school. Anything to avoid having them perform this nebulizing treatment inside a nurse's office that may not have the proper ventilation, or we do not have the proper N95 masks to protect yourself.
Thank you, Megan. Dr. Balogun, if a child is sent home with a symptom such as diarrhea, should the school require a physician's note upon return?
Thank you, Tom. That has been our process. Diarrhea is one of the symptoms could be one of the symptoms for COVID. Doesn't mean that a child with diarrhea has COVID. However, once in this general environment right now, if a child or a staff member has any of those symptoms, it's best that they do seek care through their provider, and also have really clear clearance from that provider, looking at the set of symptoms, if they have fever and other contexts to see if they need to be tested, and if they do not, really be able to get clearance from that provider to go back to work, back to work and school safely.
Thank you. Joe Kaufman, I'll throw this one to you, and if anybody else wants to chime in, please. Our district is suggesting that children have their temperature checks conducted in the classroom. Would this be the appropriate place, or would that put others at risk?
You know, I think that's a complex question, but I think that at that point, you have to consider that those children have entered the building, they've been around other people, and so my advice would be to perform those checks upon entry of the building. You know, there's things to be considered, obviously, but impeding the flow of traffic and trying to prevent everyone from getting in, because you may then find out you had a temperature in 2 students who walked into a classroom. I don't think that would be advisable in my mind, but I turn that over to the panel if anyone else has.
I agree. I think they should be tested, screened upon entry to the building, upon arrival, as opposed to waiting until they have gone throughout the school, through the hallways, interacted possibly with other children into the classroom itself.
Thank you, Megan. And you just answered the one question. Do we recommend screening upon entry to schools? And certainly we do recommend that. Megan, I'm going to throw this one at you again.
Okay.
Our district is currently recommending students wear masks on the bus, the bathrooms, and the hallways. Do you believe this is feasible?
Absolutely. I think that is the way you will, as you saw during the presentation, it cuts back on exposure at least by 50%, if not more. It is very important, like we said, we are all wearing masks. We are socially distanced and wearing masks. I think it's very important to wear masks throughout the hallways, in the bathrooms, even in the classrooms.
Dr. Balogun, I'll throw this one to you first, and Megan may want to chime in as well. If there are no other risk factors present, should the age of the staff member be considered for their safe return to school?
In terms of our return to work process, our current process, age alone is not a defining factor in terms of risk for COVID. It really is age and a comorbidity. So, you know, having a staff member who is of a certain age would not, by definition, be a standalone reason to have concerns for COVID. It's really underlying medical conditions, and,
I
you know,
agree.
Megan, I don't know what your thoughts are on that.
I agree with you. Yeah.
All right, keep coming, Megan. Nebulizer treatments do need to be performed in the nurse's office. Will the office need to be closed for a period of time during and after?
So that would really depend on the amount of air circulation in that office. If, like I said, the CDC guidelines are if you can perform them outside, or if you can have windows open. I know a lot of these nursing offices do not have enough windows. They only have one small window. And also, again, it is very important, because that is an aerosol generating procedure, to have an N95 mask during that, while administering that nebulizing treatment. All of these factors play in. I know that for ambulatory, I do a lot of the ambulatory offices with Inspira. I'm an infection preventionist for them. Our rooms, exam rooms, we have them shut down for 2 hours, no one in it, prior to even going in and cleaning the entire surface. And again, you have to let those surfaces stay wet for the appropriate contact time, whatever, you know, disinfectant that you are using, whether that contact time be 2 minutes or 10 minutes, and it has to stay wet before you can wipe it and finish cleaning that area. So it's kind of touch and go with these nebulizing treatments. I understand one of my children has to have an inhaler, but it's touch and go. It's a little bit nerve-wracking, because a lot of these buildings do not have the adequate ventilation to be able to perform those inside of a school nurse's office.
Thank you, Megan. Dr. Balogun, do you think schools should have isolation rooms to house sick children?
If feasible, I think it is important that once a child has been identified that has symptoms of concern, that they be removed from other children who may be in the nurse's office for other issues. Of course, that may not always be possible in certain school districts or buildings, but whenever possible, yeah, we should try to further isolate them until they can hopefully be picked up by a parent and taken to a provider for further assessment.
Thank you. And there is another question here around an isolation room and whether or not we have any recommendation for the type of room, the air related to that room. And I think that's going to be building specific. We're certainly willing to have a discussion with you to share some of the things that we did, but it's a very difficult question to answer without knowing the specifics of your building. But again, we will be a resource going forward. Let me see. Joe Kaufman, should physical barriers be placed in the nurse's office?
Again, not knowing the layout of the room, I feel that that's sort of a difficult question to answer, but I would say if possible, yes, where possible in those particular situations. And again, I would probably ask Megan for her input on that.
I think that it is difficult not knowing the layout of the room for the school nurse's office. If you have the ability to put physical barriers in between beds, if you have like 2 beds and you're able to put a barrier in between to separate children, then that would be beneficial. But again, if we don't know, if it's not possible, it may not be completely possible depending on the size of the room and what you have available.
All right. Megan, this is going to be another question around temperature checks, and I know you answered this, but they got a little bit more specific here.
Okay.
We plan to do temperature checks immediately when students enter the classroom within 15 minutes of entering the building. For safety reasons, we cannot take temperatures and exclude students from entering the building without an adult to take custody of that child. So they're talking about the limitations they have in how the kids enter the building, and I guess in mitigating the risk, would that be an acceptable thing in your mind?
So, I'm so sorry. Are you asking about adults entering into the building as well to drop off and pick up?
They're talking about students entering the classroom, basically to have the temperature check done within 15 minutes of
Okay.
entering the building.
I honestly, it is in the New Jersey Department of Education guidance as well as the CDC guidance, it is asked that you check them upon entry, upon arrival, as best as you possibly can. I understand there are some difficulties, but as far as guidance is concerned, it is suggested upon arrival, upon entry into the building to be screened.
Yeah, and again, I think everybody will have to make their own determination for how they can accomplish that. Another question is, do we highly recommend temperature checks for staff and students? And clearly that answer is yes, we do.
Tom, if I may just expand on that. I think this question and understanding some of the limitations of waiting to screen once a staff member or student gets on site really does bring to mind then the importance of that communication piece with parents and students and staff members to try to start with an at-home process, with the thought being that hopefully if they're self-screening and completing the self-assessment at home, you will have less persons presenting on site with symptoms. So it's really important to make sure that we use those 2 resources or processes as a complement.
Thank you, Dr. Balogun. And here's another one for you. Do you feel that staff who are at risk and have multiple risk factors, such as over 65 and something like diabetes or heart concerns, should they have medical clearance in order to return to work in the fall?
And this would be for me?
For you,
Okay.
yes.
So it is, what we know about COVID is that we have more concerns for persons who have comorbidity. As a matter of, I think, a general chronic care management, it would be pertinent for anyone that has a concern or knows that they have those comorbidities to start a conversation with their healthcare provider before the start of the school year, and then really also make sure that they have a process for continual general management with their provider. With respect to a specific clearance, I don't believe a specific clearance is necessary. It is more important to just make sure that they have established a relationship with their provider of record, that their provider of record really understands what their needs are, and that they have a process in place for having periodic checks throughout the school year, as we would probably recommend for anyone of a certain age who has those comorbidities to start with.
Thank you. Megan, is a curtain considered a physical barrier?
It can be. I think I think what we would prefer is a plexiglass, plastic kind of barrier. That is what is preferred. I mean, with the curtain, droplets could always possibly get through. However, if the student has a mask on, if the other student has a mask on, it could possibly be considered a barrier. However, a plastic plexiglass barrier would always be preferable.
Thank you. Dr. Ballaghan, I'm going to start with you, and Megan or Joe Kaufman, you can jump in on this one. Talking about school sports. They're planning to start practices next week. Students will be social distancing in 10-person pods. If there is a positive in a pod, would the entire pod be required to quarantine, and what about the coach?
That's a great question. That really depends on the amount of contact between the student who has tested positive and the rest of the players and coach. If it is a sport where there's significant contact, I certainly would urge that the other members have a conversation with their providers. They don't necessarily need to quarantine if they're not symptomatic, but I would say that in conjunction with conversations with their provider, they probably would need to at least have a specific screening process where they're checking their temperatures on a daily basis. They are really cognizant of what symptoms to be aware of. And I don't know if I would necessarily say that the entire team needs to quarantine for 14 days for each episode, other than just to say that the provider should be aware that this has happened and provide other instructions.
I agree.
One thing I would add too is with those 10-person pods, think down to if you have a point where they're all going to come together, is there a locker room? Is that being considered, equipment? Where is that being stored? Is it all being stored together? And those types of things.
Thank you. Megan, this is an interesting question, again, around the N95s. For a school nurse to avoid quarantine with positive contact, is an N95 recommended, assuming they're not going to be able to social distance and it's going to be less than 10 minutes of contact?
I mean, an N95 would always be preferable. However, depends on access to N95s. Like I said, as long as CDC guidance is a surgical mask to keep out droplets is recommended. But again, it depends on your school, what you have availability to. And N95s are really, like I said, unless you're really doing an aerosol generating procedure, a surgical mask should be sufficient enough.
Question, how can our school district request PPE? Joe Kaufman, can you?
Sure. So as we said, we'll be sending out the presentation, but on the screen, hopefully, there is contacts of both myself, Joseph Kaufman, so mine can be emailed at kaufmanj@ihn.org, or Joe Dorella can also be emailed at dorellaj@ihn.org. Like I said, we'll be sending that out, but certainly we don't mind being first points of contact to try to help you.
Thank you, Joe. If it is determined a student or family member or staff are positive, what should the school do about notification of other people and any quarantine issues? I think that goes a little bit to the contact tracing, and can you talk a little bit about that, Megan?
Yes, I can. So the Department of Education guidance suggests that you have one staff member dedicated to doing contact tracing within your school, suggesting that the school nurse would be the one to be doing the contact tracing. There's a recommendation to take the online Johns Hopkins contact tracing course to give you a background with that. And the Department of Health is going to be largely doing a lot of the contact tracing outside of the school. Your role in doing contact tracing and notifying will be to identify the close contact of the child who is within 6 feet of that child for 10 minutes or more, identifying the areas of the school that the child or staff member, if they were positive, was in during the infectious period while they were still attending school. The infectious period meaning 48 hours prior to symptom onset. It would be advisable to create a line list and have the students on the line list that are exhibiting symptoms, what their symptoms were, the room number that they were in, if they were tested, and the result. As far as notifications go, there's going to have to be some kind of policy within your school about notifying other students' families that they may have been exposed. They were in a classroom with a student who was positive. You do not give out the name of the student, but just notifying them that they were possibly exposed. And the Department of Health wants to be notified of any notifications that are sent out from the school, and they will want to be notified with any positive students that you have as well. The Department of Health has been doing contact tracing throughout this entire pandemic, and they should give you lots of guidance regarding contact tracing. So they are always a good resource to reach out to them for more information about contact tracing.
Thank you, Megan. Dr. Balogun, we talked about the fever level being 100.4 as the concern level. If a student shows any symptoms, and we've listed them here today, if they show any symptoms, should they be sent home?
So this is a good question. Certain students have other medical conditions that can certainly present with symptoms that are on that list that we have referenced for COVID symptoms. In particular, a student that has allergies may come to school with or present with some nasal congestion or stuffiness. I think it's really important in terms of the environment that we're in right now to take an approach of caution, making sure that we assume that it is and have that ruled out, as opposed to the converse, which is assume that stuffy nose or allergy type symptoms are just because of their usual allergies and miss a case of COVID. So that is the approach that we've used in terms of how we've managed patients through our urgent care, employee health, and occupational health departments. And that would be the same process that I would recommend for assessing a student that presents with any of those types of symptoms.
Thank you. Megan, should students be able to use water fountains this year?
So my concern with the water fountains, knowing that my children have a tendency to put their mouths on the fountain, it would have to be disinfected after each use. Also concern about the reusable water bottle fountains. Again, I have young children, and I know that they would not be able to get that water bottle directly under that stream without touching any outer surfaces. And again, it would have to be disinfected after each use, because if they're anything like my kids, their water bottle's going to be touching the side, touching up top, and and then they might put their mouths on there. So honestly, I think the water fountains should probably just be null and void at this point, or have to be disinfected after each and every single use, yes.
Thank you. Joe Kaufman, I want to see if you know the answer to this. I'll answer part of it, and I'll see if you know the second part. Will exams and testing be available for uninsured, undocumented students? I would say we will figure that part out. If you need that help, please let us know. And then, do testing sites test young children?
I want to actually throw that to Dr. Balogun. Do you know
Okay.
the answer?
Our current testing
Yeah,
site,
current testing sites.
we would be able to test young children, yes. I mean, the testing process is no different for an adult versus a child, with the exception if we have a child who's a little bit younger and maybe needs to be coached through the collection process, that would be a slight difference.
Thank you. I'm going to handle this next question if any of the other panel wants to jump on. I have students in pre-K through 6th grade, approximately 370 students, only one nurse. What would your recommendation be for daily screening? I can tell you here, we repurpose people, we just get people to help where they can. And that's what we've seen for the past 5 months, and I think that's our plan to continue as well. I think that would be our answer there. I'm not sure we're going to have an answer here, but I'm going to read this one because it's a concern. What would you do if you need to send a sick child home, but the parent refuses to pick up or is unable to pick up? I think we did talk about if there's an ability to do an isolation room, but I don't know if any one of the panel wants to jump in on how they would handle that piece.
Again,
Thank you.
per Department of Education and CDC guidance, it is preferred to have an isolation area, an isolation room, to have that child wait in until they are able to be picked up. So yes, there should be an isolation area.
Thank you. Let me see the next question. Megan, we would like to have the parent staff to temp check prior to attending and doing a symptom check at home and sending in a report to the school daily. Is that an acceptable way to handle the temperature check?
I think that it would be another level of symptom reporting. I think that it would be we should also be screening upon entry, because you may not have an appropriate temperature check at home. Maybe they don't have a thermometer. Maybe their thermometer reads off. Maybe they want to send their child and may cover up that temperature. So I know that Dr. Baligan spoke about reporting symptoms prior to entry into the school, but I also think that it is important to have a screening point upon entry into the school as well.
Thank you. Megan, again, if a student is unable to wear a mask due to a medical conditions, would you suggest that student wear a shield?
The only thing with the shield is it's open on the bottom. It's open on the sides. Your shields are really just meant to supplement, to kind of protect your eyes from any droplets that may go into your eyes. Goggles would also be another form of protection in that respect. So a shield without a mask is not enough to protect you or to protect a student, unfortunately. Masks are the first line of protection, and then a shield would just be another level of protection.
Thank you. And this is just a comment that I'd like to share with my colleagues. This is a wonderful presentation. Great job to the entire Inspira team. So resourceful for the entire community. We appreciate that comment, certainly. Dr. Baligan, is viral conjunctivitis considered a possible symptom of COVID-19? Should students and staff be excluded from school for 72 hours from any symptom of COVID-19 or only for fever?
So just to be clear, there are cases where patients that have subsequently been tested positive for COVID have been found to have presented with symptoms that were presumed to be viral conjunctivitis. So the two are not necessarily synonymous. They are having symptoms that appear to be viral conjunctivitis, but it's a different process. So, but if a patient if a teacher, staff member, or student presents with that symptom and we're not very clear that it is viral conjunctivitis, and or there are other symptoms that may be suggestive of COVID, then yes, they would, as we've addressed, should also be sent through the similar process for further evaluation to conclude if they need further testing or workup.
Thank you. We have a question here, and again, I don't know that we're going to have an answer, but I'm going to address it. Do we have any resources for families who do not have access to thermometers? I don't know if there are any resources out there, but that is a question I'm going to take to our leadership to see if there's a way we may be able to help in that circumstance. Let's see what the next question. There's a number of questions, again, about the temperature checks, about whether it's required, about whether, the challenge of it. and again, every school is going to have to make their own choice here. We're communicating what we would consider to be the highest level of safety. And that's obviously paramount to us as a healthcare organization. We certainly understand limitations that all schools will have. Anything's better than nothing. Doing it at home, better than not doing it at all. But again, our best practice is symptom checking on site. I certainly know a lot of parents that in the past have sent their children to school, loaded them up on Tylenol, got that fever down, but they were sick. And we're never going to avoid all that. But again, where we can do it on site, that is certainly our recommendation. If a child or staff member is determined to be COVID positive, who within the school must be quarantined? Megan?
So this kind of goes back to the contact tracing and Department of Health assisting with all of the contact tracing and the questions regarding this. So the student who is positive will be required to quarantine. And again, that information will be coming from the Department of Health, who will be getting in contact with that student and their family. The Department of Health will then want to know, again, who is a close contact of that student, meaning within 6 feet or more for 10 minutes, or 6 feet or less for 10 minutes or more. And that's where that line list will really come into play, so that you can go and check and say, okay, this student was in this classroom, room 204, and they were on bus 10, and who was on those buses and who was in that classroom. And again, the Department of Health will want to know that information, and they will want to know, and they will give the guidance regarding any kind of quarantine and symptoms. I mean, anyone who has come in contact with this child will want to monitor for symptoms. As far as quarantining, if they were in the same classroom, really, it depends on, again, if they were within 6 feet or less, if they have symptoms, and again, that will be coming from the Department of Health. They have been doing all of the contact tracing, and they have been giving out all of the guidance throughout this entire pandemic.
Thank you. Megan, another question around reporting. If a school sends a suspected student home, is there any notification required to the Department of Health at that point?
I do not believe so, not unless they test positive.
Thank you. Are air purifiers recommended for the nurse's office? Megan?
I don't necessarily know if an air purifier is going to be recommended. I haven't read anything about that. Really what we're looking at is, and it depends on your building, the air exchanges in that room, because again, any kind of aerosol generating procedure should not be performed in a room inside that school. It should be outside of the school or at home.
Thank you. Should we require a doctor's note prior to return from school from a child sent home with presumptive COVID symptoms prior to them returning? Or do we automatically exclude them for 72 hours? Are we able to request a negative test result documentation prior to reentry?
So I'll provide a response to that. Now, I would provide a two-part response. To the first question of if we should require a doctor's note, my answer would be yes. I think there needs to be a very clear process of the reasons why a child would be removed from school, and as well a clear process really confirming that the child is now safe to return back to school. And that involves communication between the school, the parent, and the child's provider. And so to close that loop, I think that the requirement of a note would be very important in that sense. To the second, which I believe it's, can we then ask for confirmation by the school that the school wants a copy of that note or the test? I think that second part, certainly if at any point where the parent is willing to share additional information, that would be great. However, if you have a note from the doctor clearing the child to come back to school, then really the assumption is that it is a negative test. Otherwise, there are some liability issues for that provider if there's any harm to other students or staff based on information that they did not either appropriately process or held back. So I don't know if necessarily parents would have the time or ability to get the test and present it to the school, and then the question is where that's going to be filed. I think at minimum, requiring the return to school note should suffice. Anything else that the parent wants to provide would be fine, but I don't necessarily think that the second part becomes a necessity.
Thank you, Dr. Balakin. Megan, I know you've talked about contact tracing, and let's just clarify with this question. The DOH told us that we would be doing contact tracing and phone calls for all school-related exposures.
So yes, so that goes to anyone that was a close contact of that positive student, contacting that family and saying that your student, your child may have been exposed, was within 6 feet or less of a positive student. And again, Department of Health wants to be notified of any of these notifications because they will want to do their own contact tracing as well. And like I said, that's where that line list comes into play of keeping track of these students, who was positive, who was in that classroom, interviewing the teacher to see who was within close contact with this child, what bus they came in on, where they walked going to the classroom, any kind of areas that they may have been throughout the school. They'll want to know who the child was in contact with. So as far as notifications, it's up to the school policy of who notifies the families and also notifying the Department of Health. And that's where they really the Department of Education really wants one devoted staff member, usually the school nurse or someone to assist them in doing all of this.
Thank you, Megan. And we are coming near to an end, and I have one more question here I want to get through. And Megan, the question is really in the definition of what is exposure. Would that only refer to close contacts, being 6 feet for more than 10 minutes? So how would we define exposure?
Exposure would be within 6 feet or less for more than 10 minutes with or without a mask. So that would be considered exposure as far as notifying families and also reporting to the Department of Health. That would be exposure, yes.
Thank you. I do really want to thank everybody for their lively participation. We've answered a lot of questions, and we still have 36 more in the queue that we will not get to live. What we will do is we will go through and have our team of experts look at all these questions, and we will provide, along with the recording of this presentation, we'll give you a copy of the presentation, and we will also submit a Q&A for all the questions because there's clearly a need here for more information. So again, thank you so much for joining us. We look at this as a beginning. This isn't a one-time thing. I think going forward, there's going to need to be greater collaboration between our health system and our school districts as we, again, continue to go for safety for our community and for our students and for all the employees. So thank you very much.